Radio 7:30 AM.
Tune in to the Wellness and You show every Tuesday afternoon from 3:05 to 4 right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. I'm Karyn Rudd, the host of the Wellness and You show and a therapeutic body worker of physical therapy. To book an appointment for physical therapy or to be a guest on the show, call 868-301-4500. Join me, Karyn Rudd, a therapeutic body worker for physical therapy and the host of the Wellness and You show that airs every Tuesday afternoon from 3:05 to 4 right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. See and hear us live in HD or high definition by visiting www.inspirationalradio730.co.tt. If you'd like to book an appointment for physical therapy or be a guest on the show in the area of health, fitness or wellness, please call Karyn Rudd at 868-301-4500 or visit the website www.karynrudd.com, KARYNRUDD.com for more information. Good afternoon, Trinidad. Good afternoon, Tobago. Good afternoon, Caribbean and South America, and to those of you logged on to the World Wide Web. Welcome to the Wellness and You show. I am Karyn Rudd, the host of the Wellness and You show that focuses on the wellness and health in body, mind, soul, and spirit. A show where various professionals in their respective area or areas of health and wellness express their views and opinions, where we become informed, educated, enlightened, motivated, and inspired. A show that invites you, the general public, to call in to express your views, opinions, and questions. The Wellness and You show airs every Tuesday just after the 3 o'clock news until 4 in the afternoon. It is streamed live in HD or high definition. If you wish to see and hear us live, just to log on to www.inspirationalradio730.co.tt, www.inspirationalradio730.co.tt. The Wellness and You show does not directly nor indirectly dispense medical advice nor prescribe treatments for sickness without medical approval. Nutritionists and other experts in the field of health and nutrition who appear on the Wellness and You show hold widely varying views. It is not the intention of the Wellness and You show neither to diagnose nor to prescribe. The intention is only to offer health information to help you cooperate with your doctor in your mutual quest for good health. In the event that you use this information without your doctor's approval, you are prescribing for yourself, which is your constitutional right. However, the Wellness and You show assumes no responsibility. I am a United States trained and certified infant touch and massage instructor, deep tissue, pre- and postnatal massage therapist, reflexologist, craniosacral therapist, Reiki master, EFT or emotional freedom technique practitioner, equine or horse sports massage therapist, and an Ephraim Hunt certified professional makeup artist. The human body has an innate ability to heal itself with its built-in mechanism called the immune system, also known as the lymphatic system. However, due to distress, trauma, or dis-ease, physical, mental, emotional, psychological, and physiological issues may surface or take form. The modalities or the various modes or methods of therapeutic intervention that are offered can improve your body's natural built-in ability to take better care of you. These methods or modalities can relieve a full spectrum of pain, illness, and dysfunction, including migraines and headaches, chronic neck, back, leg, and foot pain, strains and sprains, bulging or slipped discs, pinched nerves, spondylosis, scoliosis, stress and tension-related disorders, infant and childhood disorders, chronic fatigue, fibromyalgia, TMJ, known as temporomandibular joint dysfunction syndrome, edema or swelling, and inflammation, just to name a few. A typical therapeutic session takes place in a quiet, private setting where one lies comfortably on a padded table. Manual techniques are then used to release those problem areas and improve the form and function of the body. What a person experiences during the session is highly individual. To book an appointment for therapeutic body work, feel free to contact me, Karyn Rudd, at area code 868-301-4500. That is 868-301-4500. You can also visit my website at www.karynrudd.com, and that is KARYNRUDD.com. You can also email me at karynrudd@gmail.com, as well as you can go to Facebook, where I've got a web page called Karyn Rudd Wellness and You, and you can click on the like button and be apprised of upcoming events on this weekly program. When you call to book an appointment, please remember to leave your name, a message, and a contact number. If no contact number is left, unfortunately, the call cannot be returned. So, I welcome you to the Wellness and You show, and today our subject matter is going to be about diabetes. For the next 5 shows, well, this being one of the 5, so for the next upcoming 4 shows, including this show, we're going to continue our conversation on diabetes. We've got Dr. Steve Singh coming up at 3:30 this afternoon. He'll be calling in. He won't be here in present today. I did interview him last week, Friday, here at the station, and the information was quite astounding. Some of the things that were shared here with us blew my mind, and I know that it must have blown some of your minds as well. So Dr. Steve Singh will be calling in at 3:30, as I mentioned, and of course we'll be opening up the phone lines. We always love hearing from you, and it's really astounding how many people in Trinidad and Tobago have diabetes. According to the information that was shared at the Diabetes Association of Trinidad and Tobago's symposium last Saturday that I attended, according to statistics, Trinidad and Tobago is the 3rd in the world for obesity. Believe it or not, as small as we are, the population that we have, Trinidad and Tobago is the 3rd in the world for obesity. And there are 200,000 people with type 2 diabetes. This is reported. What about the number of persons who are walking around and even they don't know or unaware that they're diabetic? So when Dr. Steve Singh comes on the air, we're going to talk a little bit about that and what he suggests in terms of how people ought to be tested. And he suggests, really and truly, the blood fasting or the glucose tolerance test he recommends. However, what he really, really stresses is that after we've had a meal, 2 hours after, to go and test or have our blood sugar tested. And if it's over 140, then if the reading is over 140, then he strongly suggests that a person would go and see their health practitioner or their medical doctor to continue further testing. So diabetes is considered right now an epidemic at epidemic proportions in Trinidad and Tobago. It's frightening, it's staggering. As I mentioned, with 200,000 people who are type 2 diabetics and 1,000 being type 1 diabetics. And then there's something I'm going to talk to Dr. Singh about today, because I was really impressed with his presentation on Saturday gone at the symposium is what I meant to say. And Dr. Steve Singh is a medical officer and head of the health services unit and a family physician, and his talk was a practical guide for the management of your diabetes. And I had to make a note of something he said because it really, really impressed me. Dr. Singh stated that movement of muscle gets the insulin to work better. Movement of muscle gets the insulin to work better. Now, over the years, I've been doing the work that I do now for the past 13 years, 1-3. And over the years, I have really stressed and impressed upon everyone the importance of moving or mobilizing the body. And I've stated that, excuse me, in terms of increasing the metabolism, improving blood circulation, and the circulation of lymph, which is the matrix that transports toxins out of the tissues and eventually out of the body by way of urine, sweat, and fecal matter. So I have really been impressing that upon everybody, and some people would respond by saying, well, you know, I work in the garden all day long, or I'm in the kitchen all day long, I'm doing things all day long. What Dr. Singh stressed in particular, he strongly suggests that we do at least 30 minutes, 30 minutes of continuous movement every day. So he suggests either walking, running, cycling, swimming, whatever you're able to do, that it be at least 30 minutes of continuous movement. Because according to Dr. Singh, movement of muscle gets the insulin to work better. So we're going to talk some more about that when he calls, and I'm really excited. I had hoped that he would have been able to come here in person because, as you know, this program is in HD, and you can see us and hear us live by just logging onto the website www.inspirationalradio730.co.tt, and that way you can see us and hear us live, which is always a treat. Now, as I mentioned, including today, would be 5 weeks of 5 continuous Tuesdays that we have various health practitioners and medical doctors here on the Wellness and You show, just for you and for me, so that they can continue to enlighten us and inspire us about diabetes. So today, as I mentioned, we've got Dr. Neil Singh coming up at 3:30. He'll be calling in. And then next week, Tuesday, the 25th of June, we've got Mrs. Judy Ramdeen, and she is the diabetes nurse educator for DAT. And that is not DAT as in THAT, but DATT, Diabetes Association of Trinidad and Tobago. And then Tuesday, July 2nd, we've got Dr. Sonia Roach Barker. I'm really excited to chat with her. I got to meet her at the symposium on Saturday. Lovely lady indeed. I've only heard good things about her over the years from my clients who've been to her, and really excited about chatting with her. So that is Tuesday, July 2nd. We've got Dr. Sonia Roach Barker, and she's going to talk about diabetes and menopause. And then the following Tuesday after that, Tuesday, July 9th, we've got Dr. Virendra Singh, who is a pediatric endocrinologist. And that ought to be quite interesting as well, especially for us women. And then the 5th Tuesday, being Tuesday, July 16th, we've got Dr. Steve Medford, who will be in to chat with us about sleep apnea and diabetes. And let me tell you a little something about sleep apnea. Sleep apnea, I personally have sleep apnea, that's why I can talk about it. And, excuse me, some years ago, when I lived in the US, I would wake myself up sometimes gasping for air, not knowing what in the world was going on with me. Had a chat with a doctor, and he suggested that I go and have a sleep study done. So had it done, and how it's set up, you go to a building where the sleep study center is set up, and you'll take your night clothes, and they will attach all of these electrodes to your head and different parts of your body, and you lie down on a bed and you sleep. And during the course of the time that you sleep, they will check to see, or the machines will detect whether or not you stop breathing. And many of us are unaware that we're not breathing unless we're told by someone that we've stopped breathing, or as in my case, I would wake up gasping for air and not knowing at the time what on earth was happening with me. So I had no idea that sleep apnea can actually bring on diabetes. And all of this I learned from this symposium on Saturday. They stated also that depression can bring on diabetes and a number of things, but especially sleep apnea. Now in Trinidad, we have a number of centers, sleep centers in Trinidad, where a person could go and have a sleep study done. And I strongly, strongly recommend that if anyone has ever told you that you stop breathing, that you ought to go and have yourself tested. For me, a number of years ago, this was in the 1990s, I stopped breathing. The machines detected that I stopped breathing 3 times within an hour. Now that's really, really bad. It means that the heart is being deprived of vital oxygen that would normally be in the blood. My brain was being deprived of vital oxygen. So now there's a special machine called a CPAP that one would attach to one's face that would facilitate keeping the air passage clear so one can continue to breathe throughout the night. In my case, they did not suggest that I needed that at the time. So what they did suggest, however, is that I sleep on my side. So now I sleep on my side, and at least it keeps my air passage clear. If I dare fall asleep on my back, that's it, it's all over. I'm waking myself up gasping for air. So please, I would strongly suggest, if you have a feeling that you may not be breathing at certain times during the course of the night, or if you've been told that you stop breathing, please go and have yourself tested at a sleep center. So that's Dr. Medford, who will be coming up on Tuesday, the 16th of July. I'm really excited to chat with him. His speech, Dr. Steve Medford, his presentation was awesome. I was so excited when I heard the information. So to also inform you, we've got a couple of things coming up. There will be the diabetes counseling and testing by trained diabetes nurse educators at the headquarters in Chaguanas, Tuesdays to Thursdays, starting on Thursday, June 27th. You can call 672-0864 or 672-2379 to set up your appointment. So I'll read it again. There will be the diabetes counseling and testing by trained diabetes nurse educators at the headquarters in Chaguanas, Tuesday through Thursday, starting Thursday, June 27th. A number again to call, 672-0864 or 672-2379 to set up your appointment. As I mentioned, there are many people who are walking around who are pre-diabetic or may even be diabetic and not know it. If you've got issues with insomnia, if you've got dryness of the mouth, if you've got perpetual thirst, continuous tiredness, all of these could be signs and symptoms of being pre-diabetic or diabetic. So you really need to get yourself tested. And the other announcement is the International Society for Pediatric and Adolescent Diabetes, ISPAD, is hosting their 3rd course in the Caribbean, Management of Diabetes in Caribbean Youth. Are there cultural differences? And this will be from July 27th and July 28th at the Cascadia Hotel here in Trinidad. This course is for physicians and members of the diabetes management team who want to acquire or improve their knowledge of type 1 and type 2 diabetes mellitus in children, adolescents, and young adults. So there you go. There's some information for you. So I'm pretty excited with the guests that are coming up over the next number of Tuesdays. As I mentioned, it's now 3:23, so as I mentioned, hold on to your seat because Dr. Neil Singh will be calling in, or rather, we will be here and getting him on the line soon at 3:30. And of course, he will do his thing, and then we'll open up the phone lines so you can call in and ask questions of him. And as knowledgeable as he is, I'm sure he'll be able to address those questions very confidently. Okay, so in the meantime, until 3:30 comes around, I would like to talk to you a little bit about reflexology and diabetes. time permitting. We've got about 6 minutes left. So reflexology, excuse me, is one of the modalities that I do. And reflexology is a science that deals with the principles that there are reflex points on the hands and the feet as they relate to all of the organs, glands, and the systems of the body. All the nerves of the body originate in the spinal cord, and they all end in the feet. So, I've been asked on many occasions whether reflexology is a safe treatment for people with diabetes. I'm never 100% sure where this concern arises from, but personally I think people are concerned due to the circulation and nerve trouble that can often develop in the feet as a result of diabetes. So the first thing to point out is that reflexology is actually incredibly beneficial for both circulation and the nerves within the feet. And aside from all the other benefits that can be gained by regular reflexology for diabetes, or diabetics rather, the benefits in reducing foot discomfort, in my experience, really are quite amazing. And I've seen it so many times over the years where people come in and they're diabetics and the feet are swollen, and by the time the session is over, the swelling has gone down, and it really does help. Over the years, I've had many, and I have many clients who are diabetic and type 1 and type 2, and they really benefit from both the massage therapy and the reflexology, especially with the numbness in the feet and the pain in the feet. So what exactly is diabetes? Well, the diabetes is a metabolic disease that results in the individual having high blood sugar levels. Your blood sugar levels are controlled in the body by two hormones. Glucagon causes cells to secrete stored sugar into the blood, and it increases the blood sugar levels. And insulin causes cells to absorb sugar to decreases the blood sugar levels. In diabetics, or rather in diabetes, the insulin does not work correctly, resulting in blood sugar levels getting too high. The increase in blood sugar levels as a result of diabetes, have three main symptoms: an increase in urination, thirst, and hunger. I think that ought to be thirst, so I stand corrected there. Rather, thirst and hunger. If the blood sugar levels stay too high over a long period of time, they can lead to vision changes due to a change in the shape of the lens of the eye. However, if the blood sugar level is returned to normal, this will often reverse itself. Now, diabetes can also cause nausea, vomiting, abdominal pain, and hyperventilation. There are three main types of diabetics. Number one, this is often referred to as insulin-dependent diabetes, because this is when the pancreas does not produce enough insulin and requires injections to control the blood sugar levels. Type 2, when the cells of the body develop a resistance to insulin and they do not absorb sugars out of the blood. And then there's, of course, gestational diabetes. During pregnancy, the pancreas needs to produce extra insulin, and if it doesn't, this can lead to a pregnancy-related diabetes. Now, how can reflexology help? Reflexology is great for the localized symptoms of poor circulation and neuropathy, a tingling or numbness or coldness, pain or loss of sensation due to nerve damage. But reflexology can do more than that. By working on the feet to stimulate and balance the whole body, and by spending time on specific areas within the body through reflex points in the feet, reflexology can help to return the body back to a balanced state and encourage a general feeling of health and vitality. By working on the pancreas, okay, we've got Dr. Singh on the line. Good afternoon, Dr. Singh. Welcome.
Good afternoon, Karyn. Thanks for having me on your program.
Yes, it's lovely to have you again. I just mentioned to the audience some of the statistics that were shared during your presentation at this past Saturday's symposium, 23rd symposium, where you mentioned that there are 200,000 type 2 diabetics in Trinidad and Tobago, 1,000 of which are type 1 diabetics. And of course, my big thing that really struck me with your presentation was that movement of muscle gets the insulin to work better. So, Doctor, I am so happy that you call in, Dr. Singh. At a certain point, we're going to open the phone lines so people can call you and ask you as many questions as they want, because it's always great to have a professional here, and that way people can have their questions addressed. So, Dr. Singh, could you tell us a little bit about why Trinidad and Tobago is in such a state? Why is it a pandemic? Why is it that
Karyn,
Trinidad and Tobago is number 3 in the world for obesity? How did we get there?
Right, and it's not just Trinidad and Tobago, Karyn. It's a lot of the third world countries, primarily Latin America, South America, the Caribbean. Many of the third world countries have an epidemic of type 2 diabetes, which is directly related to obesity, which is a lifestyle disease. And obesity is actually growing in the younger individuals. So we have a problem with childhood obesity. We have a problem with teenage obesity, and as a result, we're seeing more and more diabetics developing, more and more people developing diabetes even at a younger age. So, as I alluded to in my talk earlier, that the fattest nation in the world is North America. And because we eat and drink and live North American lifestyles, you'll find that we are falling behind. We are similarly with them in terms of obesity. However, they have a very good public health program, and therefore they educate the public. The public understands a lot more, and there are a lot more restrictions and regulations on food and diet and exercise and stuff. In the third world countries, our public health programs are not very well established, and they're actually quite poor. As a result, we are eating like them, but we don't have that level of education and public awareness out there that needs to be instilled in our population to prevent this epidemic. And hence the reason why I enjoy being on these programs, to share the word around, for patients to understand, people to understand that, listen, you are at risk of chronic disease. The number one cause of death in this part of the world is chronic disease. In fact, CARICOM, the governments of the Caribbean, have actually formed a chronic disease commission, actually, and have actually mandated that efforts be put into chronic disease in the Caribbean, because they identified as one of the leading causes of death in the Caribbean. Hence, we have hypertension, diabetes, high cholesterol, heart disease, asthma, and all these other things are non-communicable diseases being very prevalent in our part of the world. Patients may think, well, I don't have diabetes and my family doesn't have diabetes, I'm not at risk. Well, I use the old term, diabetes equals gene plus environment. I try to give that equation for those who are mathematically inclined. You may have the gene, but if the environment isn't present, you may not get diabetes. Or you may not have the gene, but if you provide the correct environment, you may develop diabetes. So therefore, it's gene plus environment. Of course, if you have the gene and the environment, but then you're in big trouble. And that's why I alluded to diabetics and their offsprings. Their offsprings already have the gene. If you give them the environment, what is the environment? The environment is, number one, obesity, sedentary lifestyle, high-fat diet, excessive alcohol use, and cigarette smoking. Those are some of the things that contribute to the development of diabetes, with the environment. And if you put that environment together with the gene, you'll find that people will develop diabetes at a very young age. As I was telling patients out there, Karyn, that everything you eat and drink, everything that you eat and drink is converted into sugar in the body. And the body utilizes that sugar through its cells for energy. To get into the blood, to get into the cells, you have to have you open a door and for the sugar to go in. And the key that opens that door is called insulin. And that insulin molecule opens the door, allows the sugar to go into the cells, and we use it for energy and our daily lives. In type 2 diabetics, they're not making enough insulin, or they're making defective insulin. The insulin isn't working 100%. And this is where I alluded to weight loss contributes to improving the insulin function, and the key works better, and therefore all the sugar goes in. When the key doesn't work well, and we eat food, half the sugar goes in and half stays in the bloodstream as high blood sugar. And that is what we call diabetes, high blood sugar. And therefore, the essence and the goal of diabetic treatment is to make our insulin work better. And there are many ways we can do that. One, we can take tablets. Two, we can lose weight. Three, we can exercise. And four, we can eat low-fat, low glycemic index or low-calorie foods. Exercise, as you were alluding to, is one of the very important components of management of a diabetic. And you need to understand that exercise isn't just about going to a gym. Exercise isn't just about lifting weights and being a trainer. Any form of movement of muscle, because insulin works very on the muscle. Movement of muscle makes your defective insulin work better. So a diabetic who is moving can actually get a reduction in his blood sugar by equivalent to some medications. And therefore, it is imperative that all diabetics should be exercising. And exercise is an integral component of the management plan. And when we say exercise, we mean 150 minutes or 30 minutes a day, 5 days a week of moderate exercise.
Why are you recommending a minimum of 30 minutes, Dr. Singh?
Well, this was done science by a study called the Diabetes Protection and Prevention Program. It was a study done in Philadelphia, looking at people who were prone to, they call them pre-diabetics, and they gave those regular normal exercise, do what you want, and they give half intensive exercise prescribed as 150 minutes a week, moderate activity. And the result of the study showed intensive exercise versus the normal exercise, there was a 58% reduction in the development of diabetes. When they give another group tablets alone on normal exercise, and that metformin tablet reduced the diabetes incidence by 30%. But diet and exercise was far more superior in preventing the pre-diabetic from developing diabetes over a 4-year period. So they studied these people who were pre-diabetic, and as you know, blood sugar above, a fasting blood sugar of above 126 is considered diabetic. Between 100 and 126 is considered pre-diabetic, and under 100 is considered non-diabetic. For a 2-hour postprandial blood sugar above 200 is considered diabetic. Between 140 and 200 is considered pre-diabetic. So the pre-diabetic are the ones whose diabetes are developing, but not yet developed, not yet full-blown. And they studied these people, and they gave them intensive exercise versus regular exercise, and they found that, now, we're not saying only 150 minutes. You can go longer, but at least 150 minutes per week, which is really 30 minutes of 5 days a week, or you can do 2 days per week. But the idea is that moderate exercise, and moderate exercise would mean that while walking and you're speaking, you have to stop every 4-5 words to take a breath. That's moderate exercise. If you can walk with someone and you can carry on a decent conversation, that's called mild exercise, and that is ineffective in terms of preventing your diabetes from developing. But let me also mention that there are other benefits of exercise apart from preventing new onset diabetes. Exercise lowers your blood pressure. Exercise lowers your cholesterol. It's very well known. I mean, there are patients who will tell you that when you exercise and you sweat, you lose salt. And once you lose salt, your pressure drops. So there are a lot of cardiometabolic benefits of exercise and movement of muscle. And again, there are patients who will tell you, as I mentioned on Saturday, that, well, doc, I'm in the kitchen, I walk back and forth, No, exercise cannot be not just movement. It has to be moderate intensity, has to raise your heart rate. For exercise to be effective, your heart rate, average heart rate, must be 200 minus your age. I didn't get a chance to speak about those things. So therefore, a young
200
person,
minus your age?
A 20-year-old person, for him to have effective exercise, his heart rate on average must be 180. A normal person's heart rate is 70 to 80. So he has to be running to become effective. Now, a 60-year-old person, her average heart rate should be 200 minus 60, which is 140. 140, you can raise your heart rate to 140 by fast walking. So a ballpark figure is that if you want to measure whether your exercise is effective, your heart rate has to go up to 200 minus your age on average.
So 200 minus the age will give
your
you...
average heart rate.
Average heart rate.
during exercise for it to be cardio-metabolic effective.
All right.
Now, you
Average
can
heart rate.
exercise and your heart rate goes up to 100. You're not doing any good to yourself, really, from a heart perspective. Now, mind you, exercise has psychological benefits. Exercise burns calories. Exercise can reduce weight, but very minimal. And I mentioned that exercise, many people think that they can eat a lot of food and just exercise, and the weight will come down. One of the most difficult ways to lose weight is by exercise. Okay? Dieting is far more effective, or meal planning, or cutting your calories out is far more effective in losing weight than exercise. But what exercise does, it's to process your appetite. What exercise does, it allows you to burn out the extra calories that you consume on your meal plan, you know. So exercise has a benefit, but patients cannot rely on exercise alone to lose weight. It is not very effective, and many studies have shown that. It has to be in conjunction with strict meal planning, and in fact, you may choose not to exercise and stick to a good meal plan, and you may still lose weight. But you will deprive yourself of the cardiometabolic effects of exercise, which involves, a number of things from all your parameters. Even for asthmatics, your lung function is improved as well. So to be effective, your exercise, your heart rate must be 200 minus your age. It used to be 180, 200 minus your age to be effective. And that's where people should aim to have effective exercise.
Now, Dr. Singh, you mentioned during the presentation on Saturday, which I found rather interesting, that you're suggesting for a person to really know whether or not they have diabetes, that they ought to be tested 2 hours after consuming a meal. Could you share with us why you suggest that?
So what I'm saying is that the more sensitive test for early diabetes, right? In other words, diabetes, type 2 diabetes, which represents about 95% of diabetics in the world, takes 7 to 10 years to develop. It's not an immediate process over 3 months. And therefore, your blood sugar does not just reach 200 overnight. 1 year, your blood sugar will be under 100. Next year is 110. Next year is 120. And there's a sequential rise in your blood sugar. And if you can pick up your blood sugar in the early days, there's lifestyle changes and medication that can delay the onset of diabetes. The question is, what test is the best test to pick up early diabetes? And many of our patients go to the pharmacies, go to the malls, and they do a fasting blood sugar. Your fasting blood sugar goes high when you have established diabetes. And it's really meant to measure how well controlled your diabetes is if you're a diabetic. But if you want to pick up diabetes in the early stages, it is a 2-hour postprandial. You have a very good meal, and you go eat, and you go test your blood sugar 2 hours after.
Now, where can one go to have their blood sugar tested?
Now, blood sugar testing has been done all over the place now. The screening tests done by malls, by people. Most people test by themselves. Ideally, you can go to any doctor's office and get a sugar tested right there and then. You can go to a pharmacy. Pharmacies are all testing sugar as well.
Okay.
But you see, the one reading, of course, doesn't make you a diabetic. It's a screening tool, and it's meant to go to your healthcare professional if it's abnormal. I've seen many people go for blood sugar testing in the pharmacy. They just drank a Coke. Coke is on the finger. Stick the finger and they measure high reading, and they get scared out of the wit because it wasn't properly done. Okay. I'm giving an example, but there are many reasons where you can get wrong readings. We don't rely on one reading. The screening tool is to do a 2-hour postprandial test. If it's above 140, go and see a doctor. Because even when I pick up patients in my office whose blood sugars are high, I still send them to the lab for confirmatory tests. Okay?
And what is that confirmatory test?
The same fasting blood sugar and 2 hours postprandial.
Okay.
But it's done not using a rapid test machine, but using an ELISA. But the recommendations are you must have 2 separate readings on 2 different occasions to be high before you're considered a diabetic.
Now, Dr. Singh, we have exactly 14 minutes left of the program, and I'd really like to open up the phone lines at this point, because I know that there are many people who are diabetics in this country, and they have questions. So the number to call is 623-7301, 623-7301. We highly suggest you give us a call. Dr. Singh is here on the line with us. He is a professional. This is one of his areas of expertise. He is the person to ask questions. And one of my questions to you, Dr. Singh, in the meantime, while we're waiting for callers, is how does someone who is pre-diabetic or someone who doesn't know necessarily that they have diabetes, what are some of the signs and symptoms that one can look for?
Right. And that's a common question. And I'll preface that question by a statement. The signs and symptoms of diabetes present when diabetes is fully established. If you're pre-diabetic, you have no signs and symptoms. And therefore, you have to identify your risk of developing diabetes. And if you're at high risk, you should be tested yearly.
Well, if I don't mean to cross you, Dr. Singh, but I just want to ask you while you're answering the question, is if there are no signs and symptoms when one is pre-diabetic, then why would one be inspired to go have the test done?
Because one is at risk. And I'm going to give a list of 10 people who should get tested. Okay? It's called measuring your risk. If you're female, your waist circumference is more than 35 in its highest diameter, or your male, your waist circumference is more than 38 inches, you are at risk of developing diabetes. You should get tested every year. If you have high blood pressure, you are at risk of developing diabetes. You should get tested every year. If you have high cholesterol, you are at high risk of developing diabetes. You should get tested every year. If you're a female with polycystic ovarian syndrome, PCOS, and you are at high risk of developing diabetes, you should get tested every year. If you have a gestational diabetic, if you are a female diabetic during pregnancy, you have a high risk, about 80% chance of a lifetime chance of developing diabetes. You should be tested every year. If your mother and father, a first-degree relative, has diabetes, you're at a high risk. You should be tested every year. If you're over age 45, you're at a high risk. You should be tested every year. So the point I'm making to you, there are patients who are at high risk, and once you know you're at high risk, if my mother and father is diabetic, I'm over 45, I should test my blood sugar every year.
Dr. Singh, we have a caller on the line. Caller, you're on the air.
Good afternoon, Karyn.
Good afternoon.
Good afternoon, Dr. Singh.
Good afternoon.
Dr. Singh, you say that we follow the North American people and eat and drink all the things that are deleterious to our health, but at the same time, they have education and awareness programs to help them along, to advise them accordingly.
That's right.
But and we do not have those programs here, education and awareness programs. Why do you think we do not have the education and awareness programs?
Because
Thank you.
Thank you, caller.
I'm going to be very, very, very political with that question. At the end of the day, we are third world countries.
Dr. Singh, I'm sorry, I don't mean to cross you, but the connection seems to be a little bit flawed, so I'm going to ask you to speak a little bit more slowly, please.
Oh, sorry. Right, so I'm going to be very careful in answering that question. The answer has to do with we being a third world country and what emphasis we play on health, and how do we prioritize health. I'll give an example, Karyn. In North America, in Canada, they have banned soft drinks in primary schools about 10 years ago.
Dr. Singh, excuse me, are you on a cordless phone by any chance?
I might be, yeah.
Yeah. I'm wondering if you could move around a little bit because the connection has become
Are you hearing me now?
really
Let me go on the
filled with
landline.
static.
Let me go on the landline and I'll direct line. If you get me. Right, are you hearing me better?
Oh, yes, thank you.
Right, sorry about that.
That's all right, thank
as I
you.
was saying, that we are a third world country, and you have to understand that our priorities in healthcare may not be the same as our first world countries. And I give an example. I'll just go back to the fact that in Canada they have banned soft drinks in primary schools for the last 10 years now because they believe they had a problem with obesity in kids. In Trinidad, we have a school feeding program that serves our kids soft drinks, okay, as part of the nutritional daily meal, right? And it's a culture of, I think the present Minister of Health wants to stop. But that's an example of to answer the caller's question of why there is very little priority to healthcare, because healthcare is a cost, is a burden to society. Healthcare is, you can't measure wellness. You can measure how many operations somebody do. You can measure how many cataracts you do, and you can measure how many lives you save. But you can't measure in terms of public health.
Dr. Singh, we have another caller on the line.
Sure.
Caller, you're on the air.
I'm sorry.
You just lost that call. Caller, I encourage you to call back at 623-7301. We have Dr. Singh with us, sharing great information on diabetes. Go ahead, Dr. Singh.
Yeah, so I mean, that was just the answer to the other part of the question of the patient's other part of the answer is that the public in our country has not been agitated enough to get their fair share of good public health. They have been complacent because healthcare is free, and they believe whatever the government dishes out to them, they will accept it.
And the call is back on the air, Dr. Singh. Let me
Okay.
cross you. Good afternoon, caller. You're on the air.
Hi, good
Hello,
day.
good afternoon.
My name is Annette. I have bad circulation on my leg. Would it be possible that I could develop diabetes with that?
Well, caller, your definition of bad circulation needs to be refined a little bit. Many patients think that when they have varicose veins, they have bad circulation. When they have swollen feet from stasis, you have bad circulation. When we speak of bad circulation in diabetes and heart disease, it's actually your arteries that are clogged up from fat, which is quite different from what you would think when you have varicose veins or swelling of the feet from other causes. So that bad circulation usually results from chronic disease. Hello, Karyn,
Dr. Singh, how could one tell the difference, though?
Well,
If a person has both varicose
you need to
veins,
see a healthcare provider,
okay.
and that's what it's for. If you have a problem, I mean, at the end of the day, if somebody has bad circulation, it's developed from a process that's ongoing. So, for example, varicose veins is not a chronic disease. It's a venous insufficiency and it's swelling of the feet. That has no risk to your lifespan. But peripheral artery disease, a peripheral vascular disease, which occurs after long-standing diabetes and hypertension, is caused by clogging of the arteries that bring blood to your foot, and that's called bad circulation. And people have problems walking. They have pain while they're walking. They have pain on rest.
Okay, thank you.
Thank you, caller.
Right, so you have some very intelligent callers, Karyn. They ask some very, very, very nice questions.
Yes, we always encourage them to call. The number to call is 623-7301. We've just got about 4 minutes left or so of the program, so if you have a question to call, we can take one more call before we wrap up with Dr. Singh. Dr. Singh is sharing great information about diabetes, and we have another caller, Dr. Singh. Good afternoon, caller. You're on the air.
Hello, good afternoon.
Hello, good afternoon.
Yes, I'm diabetic. Could you take insulin and metformin? I think in the morning you take the insulin and you don't feel like sticking yourself in the afternoon that you can take metformin.
All right, so excellent question, and the answer to the question is you must never stop metformin. Whatever drug you take as a diabetic, the first drug you're given is metformin.
Yes.
And you may continue with tablets after, or you may end up on insulin. Insulin is best taken twice per day. Metformin can't replace insulin. So let's just say the doctor gave you a dose of insulin in the morning and a dose in the evening, and you want to stop the dose in the evening and take metformin. That's not acceptable. Metformin helps to make your insulin work better. Metformin has been shown to reduce weight. Metformin has been shown to prevent heart disease in the UK PDS study. It's a very powerful 25-cent drug, okay? And therefore it must never be stopped. While insulin lowers your blood sugar, the body makes defective insulin, and metformin helps that defective insulin to work better. And some people may take 20 units in the morning, 20 units in the evening. With metformin, you may require less insulin because it helps the insulin work better. So my answer to you is you should take your metformin, and that's usually twice a day, and you should take your insulin as prescribed by a healthcare provider. The only reason you should stop taking insulin is if you are unwell and not eating. So let's just say you are vomiting and diarrhea, and you're not eating, you can withhold your dose because your insulin regime by your healthcare provider was designed to cater for the amount of calories you take for the day. And if you don't consume calories, then you take insulin, you may have the risk of developing a hypo. But once you're consuming calories as you normally do, you must take your insulin. And metformin can't replace insulin, but it makes insulin work better. Okay? I hope that answers your question.
Okay, thank you.
Thank you, caller, for your call.
Right.
All right, we're not
Again,
taking
very
any more
difficult
calls at
question.
this time as we're running low on time.
Yes.
Dr. Singh, is it possible for a type 2 diabetic to get off medication altogether?
The reason why type 2 diabetic is type 2 because they're overweight. And I tell my patients, okay, if you develop type 2 diabetes, I pick it up early. If you go back to ideal weight for height, and you exercise regularly and go on a low-fat diet, you may come off medication. And I'll be very clear with you. 50% of the patients who are diagnosed with type 2 diabetes in the first instance, those who go on proper diet and exercise, the medicines are removed. But you know what? We still keep them on the metformin because metformin prevents diabetes from getting worse. But the other strong medications, and I've had many patients who have had to take off strong medications because they have actually adjusted their lifestyle, they understand their disease, and therefore they will not need medication at this point in time. But maybe 5 years down the road, they may need medication. But their weight loss and the exercise, together with the adjusted meal planning, can control their blood sugar. And that is very common in the early stages of diabetes. In the advanced stages, it's difficult. If you're type 2 diabetic taking 4 tablets and 5 tablets per day, then you can't come off. You have to actually go through a rapid change in weight for you to come off. And most diabetics, as I said before, 80% of type 2 diabetics are overweight. And if they come down to ideal weight, there's a very good chance that they can reverse their diabetic state and stay without medication.
Now,
That's the goal. That's the goal of diabetics, to get to their ideal weight for height and to eat properly and exercise regularly.
Now, Dr. Singh, if someone would like to make an appointment to see you in private practice, is that...
Karyn, as I said all the time, I do a lot of public health work, and it's not ethical for me to see patients based on our on-air conversations. I'm happy to see patients. I run a private practice in El Socorro from 3 to 6 in the afternoons. Number is 674-5746.
Could you repeat that number more slowly, please?
674-5746.
Okay.
And it's on 3 to 6 Monday, Thursday, and Saturday mornings 8 to 11. But Karyn, it is better that patient, your GP you grew up with, the doctor who you're accustomed with, you have a comfortable... I would like that patient to take the points and ideas that we discussed today and go to their private doctor and ask them and insist on them. And if the private doctor won't give them a hearing, then you change the private doctor.
Correct.
Because many patients do well with their own doctor because they have that relationship with them, you know, and they can develop and build on it. And there are many good GPs out there who understand diabetes well, okay? It is the ones in the health centers that we are concerned about, who are overworked and the patients are only given 5 minutes per session when it should be at least 15-20 minutes a session. And those are the ones who I feel some sympathy for.
Well, Dr. Singh, in closing, what are your closing statements or remarks?
My closing statements, I mean, to be honest, I'm Karyn, your program is a lovely program. Your wellness is a new concept in our society to accept. But you have to understand those patients who are prone to chronic diseases, I would ask them, please get yourself tested. If proven, diabetes is not a death sentence. I have patients living 40 and 50 years of diabetes now, and they live in beautiful lives. You don't have to lose your eyesight or lose your limb from diabetes or get heart disease and die. If you're picked up early, modern medicine now can make you live as long as anybody else as a diabetic.
Well, Dr. Singh, I thank you so much for your time today. Thanks for taking the time out of your very busy schedule to be with us again and to give us information and to share all of that with everyone. And we really appreciate your time. I know that you were here last week, Friday, for the in-person interview, and you called in again today. So I thank you so much for your time and all the great work that you're doing. And anytime you want to come back on the air and talk a little bit more, or anything that you're doing to promote wellness and health and diabetes, please do feel free to give me a call, and we'd be happy to bring you on the air again.
I'll take you up on that, Karyn. Thanks
Wonderful.
a lot for having me.
Thank you, Dr. Singh.
Keep up the good work.
Thank you.
Bye-bye.
All right, so that was Dr. Singh, quite informative indeed. And Dr. Singh just spoke with us. He's a medical officer and the head of the health services unit and a family physician. And he is all about a practical guide for the management of your diabetes. So I hope that this segment, or rather this presentation today, was of benefit to you. Well, once again, thank you very much for tuning in to the Wellness and You Show. Remember that next week, Tuesday, we continue the conversation about diabetes in Trinidad and Tobago. Please feel free to call in at the time when we open our phone lines. And thank you so much again for tuning into the Wellness and You Show. I'll see you and talk to you again next week, Tuesday, 3:05 to 4 in the afternoon. Thank you for tuning into Wellness and You. I'm Karyn Rudd. Good afternoon. Join me, Karyn Rudd, a therapeutic bodyworker for physical therapy and the host of the Wellness and You Show. That airs every Tuesday afternoon from 3:05 to 4, right here on Inspirational Radio 730 on the AM bandwidth, Radio 20.